In management of pathological or abnormal jealousy, both psychological intervention and psychiatric intervention is required. In psychological intervention, we will discuss about cognitive behavior therapy and some self-help strategies to cope with it. Cognitive behavior therapy is developed in the 1960s by Dr. Aaron T. Beck. This therapy helps people learn how to identify and change those destructive or disturbing thought patterns that have a negative influence on behavior and emotions. It basically focuses on identifying, challenging, and replacing automatic negative thoughts with more objective and realistic thoughts. Clients with pathological jealousy are given time to talk about their experiences which they might have repressed. It helps them to bring those distorted thoughts into awareness level that give them the clear picture about their present situation or condition. Now let us discuss about those kind of distortive thought patterns the client may think in pathological jealousy. We'll discuss it with examples one by one. For example, one is all or non thinking. For example, the client may think, I can never trust anybody, or I have to know absolutely that he or she loves me 100%, or if he or she leaves me, my world will end. I mean, nothing will be left. Other distortive thought patterns like fatalism is the belief that all events are predetermined and therefore inevitable. It's like a submissive attitude towards events. For example, the client may think everyone cheats me in the end. Other distortive thought patterns like overgeneralization. It's placing too much importance on minor details. For example, the client may think no man or woman can really be trusted, or everyone leaves me in the end. I mean, everyone. So, thinking this way can affect what you do and can even become a self fulfilling prophecy. Other distortive thought patterns like internalization. For example, the client may think people must think I'm such a fool, or why do these things always happen to me? Other distortive thought patterns like misuse of imagination. It happened in romantic and sexual jealousy um, more often. For example, the client may imagine, the client may tell, I imagine him or her kissing his or her co-worker, and I get so mad. Or he or she has not called me. I can see him or her with that attractive woman or man. Or mm, I can tell she or he is falling out of love with me. Other distortive thought patterns are disqualifying the positive ones. I mean, rejecting positive experiences by insisting they don't count for some reason. Like in pathological jealousy, client may deny, reject, or don't count at all those positive moments with spouse or loved ones, and remembering all conflicting and negative incidences. Other distortive thought patterns like automatic negative reactions, having habitual scolding thoughts, for example, habit of shouting, humiliating behavior whenever the partner or loved one takes his her own decision, or spend time in other significant relationships. Other distortive patterns are mental filter, picking out a single negative trait or details and dwelling on it exclusively so that the vision of reality becomes darkened. For example, like uh, thinking over and over, Why my partner has not answered to my phone? Is he or she cheating on me? That day also he has not or she has not picked up my phone. Same thing has happened. Is he less attracted towards me? Do I lack some quality? I think I'm just useless. These are the examples of distortive thought patterns that need to be addressed in cognitive behavior therapy. In cognitive behavior therapy, the therapist listen empathetically and regularly provide brief summaries to make sure that he or she has correctly understood what the client is saying so that the discussion can be moved forward. The distress caused by the experiences is commented on in cognitive behavior therapy. For example, the therapist can tell, it must make you very anxious, or believing that your spouse is having an extramarital relation must feel very upsetting to you. In this therapy or any other therapy, immediate concerns like suicidal thoughts, abusive behaviors should be dealt with before a full assessment, because this is very essential. If there is some kind of destructive behavior pattern, then that things need to be addressed first. Then challenging delusions in early stages of therapy is not productive, because the client may feel uncomfortable in first session or initial sessions. So here in cognitive behavior therapy, the therapist can give some time to the client to open up. It is extremely helpful to occasionally focus on positive aspects and achievements of the client by the therapist, because client with abnormal jealousy or pathological jealousy often present with low self-esteem, difficulties with trust, and fears about others viewing them as mad. These are the client's perspectives in pathological jealousy. So when the clinician or the therapist shows positive regard, this can help that circumvent these negative self views. There is evidence that simply improving sleep and reducing worry using CBT techniques leads to reductions in symptoms of abnormal jealousy before addressing the delusional belief, and along with increasing engagement in positive activities. These are really helpful. It raises the client's confidence in the clinician and develop the rapport between the two. Then a functional analysis need to be carried out to identify the triggers and reactions. And next thing is derealization. In this, the nature of the experience can be explained to client. Like for example, the therapist can tell to the client, I realized that part of the difficulties she seem to come from when you feel as if your loved one going to leave you. Would you like me to find out if there is any good reading on this experience? Something like that, on the basis of the distortive thought patterns. While challenging the distortive thought patterns, the therapist can communicate with the client in this way. For example, like, would you like me to find out if there is any good reading on these experiences? Or like the therapist can tell, it seems a large part of the difficulties are these terrible feelings of anxiety you get when you imagine your partner having an affair with co-worker. Or for example, like the therapist can tell, perhaps these terrible feelings are the central problem, and you would feel more comfortable and secure around your partner if those imagination were not there. This is called derealization, and it's something people often experience when they are feeling miserable. This is very essential for the client to bring those kind of distortive thoughts or belief patterns into the awareness level so that it can be reframed. In cognitive behavior therapy, um, clients are encouraged to respond differently to the triggers to reduce the occurrence of the anomalous feelings or feelings that deviate what is standard, normal, and healthy. This will prevent a vicious circle of overreaction. In this point, asking about images may be useful. Another strategy in CBT are reviewing, reality testing, or modifying the thought patterns. Once the client is aware of the negative pattern of thought, he or she can learn to reframe those thoughts so they are more positive and productive. This is called cognitive reframing. Another technique in cognitive behavior therapy is like guided discovery. Here, the therapist acquaint or aware themselves with the client's viewpoint. Then they will ask questions designed to challenge the client's beliefs and broaden the client's thinking. The client is asked to give evidence that support their assumptions as well as evidence that does not. In this process, the client will learn to see things from other perspectives, especially ones that he or she may not have considered before. This is called guided discovery, is a part of cognitive behavior therapy. Next is exposure therapy. Here what happened? It can be used to confront fears. Here the client will be slowly exposed to the things that provoke fear or anxiety while providing guidance on how to cope with them in the triggering moment. This can be done in small increments. Eventually, exposure can make clients less vulnerable and more confident. Next thing in cognitive behavior therapy is journaling and thought recording. Writing is a time honored way of getting in touch with your own thoughts. So, this is also helpful for the client. The client is asked to list all the negative thoughts that occurred between sessions as well as positive thoughts he can or she can choose instead. Another writing exercise is to keep track of the new thoughts and new behaviors the client put into practice since the last session. And other techniques like activity scheduling and behavioral activation. Here, if there is any activity the client tend to put off or avoid due to fear, can be included. Other things like behavioral experiments can be done. It involves catastrophic thinking. It means when a person usually sees an unfavorable outcome to an event and then decides that if this outcome does happen, the result will be disaster. For example, if my partner leaves me, I will never find anyone else and I will never be happy again. Here, the client is asked to predict what will happen. These are the part of the behavioral experiments. Then, in cognitive behavior therapy, relaxation and stress reduction techniques is also given to the clients. The client may be taught some progressive relaxation techniques such as deep breathing exercises, muscle relaxations, mindfulness meditation, imagery. Then the next is role playing. It is used for improving problem solving skills, gaining familiarity and confidence in certain situations, practicing social skills, assertiveness training, improving communication skills. These are all part of role playing. Through role playing, this kind of skills can be developed in the clients to cope with the jealous feelings or reactions in a healthy way. The next is successive approximation. Here, the tasks that seem overwhelming can be broken into smaller and more achievable steps. Each successive step builds upon the previous steps, so the client given gain confidence bit by bit, slowly. In cognitive behavior therapy, the goal should be SMART. I mean, specific, measurable, achievable, realistic, and time limited. In CBT, sessions generally last about an hour and take place once a week, but again, it can vary according to the needs and urgency of the situation and the client. Most of the time, CBT takes a few weeks to a few months to start seeing the results. In pathological jealousy, attachment style also affect jealousy reactions and thoughts. Individuals who anxiously attached with loved ones experience more jealousy. In fact, those with a detached or avoidant attachment express less jealousy since they are less dependent and focused in the need of the relationship. Self esteem is not consistently related to jealousy. Indeed, there are some cases in which higher self esteem is manifested in greater assertion as the individual tries to set limits on the infidelity and flirting of their partner. It is often jealousy behaviors that lead to greater threats to the relationship. Many people have emotional perfectionism or romantic perfectionism or and pure mind. These three things like emotional perfectionism, romantic perfectionism, and pure mind, these are all a kind of things affect the pathological jealousy. What is emotional perfectionism? It generally fuels jealousy since the individual believes that they should only have positive and pleasant feelings or that their partner should have these perfect feelings. Romantic perfectionism, it entails belief that one should never be attracted to or flirt with others in their past. I repeat, in their past. If the person is already committed in a relationship, then having an affair or flirting, serious flirting kind of thing, it is very harmful. But if it happened in the past and the client thinks that it should not happen, then these are the kind of distorted thinking patterns, or like the thinking that one's intimate partner should never ever have enjoyed sexual or emotional intimacy with others in their past. This is unrealistic and distortive thoughts. Third is like pure mind. It is a kind of obsessive standard that one cannot tolerate mixed or conflicting feelings. Any negative or unpleasant thoughts and feelings must be purged. Again, this is an impossible task. I mean, learning to live with noise, contradictions, disappointment, and doubt is an essential part of reality. The client need to realize this kind of distortive thought patterns. Well, that doesn't mean to tolerate immoral or illegal or harmful things, but accepting and not letting them to affect other part of your life is the intention. In pathological jealousy, couples or loved ones need to determine the ground rules of what their commitment means to them and what are their expectations. There are no ground rules, obviously, but communicating dissatisfaction also can help to learn better ways of expressing themselves. It will reduce the insecurities and it will help to communicate openly with each other. Usually, the goal is not to eliminate jealousy, as it does not work, but to find ways of incorporating jealous feelings and thoughts in a relationship. I mean, to absorb or integrate jealous feelings to make the relationship more healthy, open, enjoying, and meaningful rather than intolerable, destructive, abusing, unhealthy, and suffocating. So, these are the basics of cognitive behavior therapy uh, for pathological jealousy to address the symptoms and other self destructing or suicidal thoughts or ideation in pathological jealousy is very helpful, and the rapport between the client and therapist, the trust is very much essential to continue with the sessions. And definitely this kind of techniques or challenging those kind of distortive thought patterns and behaviors, of course, is very helpful to reduce, and it helps the clients to cope with the jealousy. Now we will discuss about self-help strategies to cope with the jealous feelings. How can the client or any person who is feeling extreme jealousy and it is affecting other areas of life, and how a person can cope with those kind of feelings? The first step: don't suppress, deny, or reject the feeling of jealousy, because it is an emotion that need to be felt, not to be suppressed. Accept that you are feeling jealous. It's okay. It's absolutely normal to feel in that way. If you are feeling so, bring it to your awareness or conscious level. Be open and honest. There is nothing wrong to admit that I am feeling jealous. In fact, admitting or accepting that I am feeling jealous itself will help the person to manage it in a productive way. Then examine where these jealous feelings are coming from. These insecurities, fears, anxieties, worries are coming from. Where are the roots? What are the roots? You can ask yourself, is it linked with childhood? Any trauma in childhood or abuse in the past? Any faulty learning from elders, parents, or caregivers that is triggering or that is affecting the healthy thought patterns? Or you can ask yourself, is it because you lack something? And if your answer is yes, then what can you do about it? For example, instead of getting envy by seeing a new car purchased by your neighbor, friend, or relative, you may work hard and focus on your savings and spending to get the same car or any car you want. It is like what you want, what you have, what you want, and what you can do about it in a healthy way. In this way, you can use your envy feelings for your productivity. Have open communication. If your partner's actions trigger jealous feelings, bring this up with your partner as soon as possible, or discuss ways to keep your relationship strong. It is totally normal to express and mention jealous feelings with your loved one if you are feeling so. You don't need to hesitate. Otherwise, those suppressed, rejected, jealous feelings, eventually it will affect negatively to the relationship. Practice gratitude for what you have. You might not have everything you want. Most of us don't. But you probably have at least some of what you want. So, for that some, show your gratitude. This practicing of gratitude really help a lot for this kind of insecurity feelings or jealous kind of things. You can turn your attention away from jealousy by doing something healthy. I mean, diverting attention whenever you feel jealous or you react in jealous ways. The moment you feel jealous, you turn your attention and do something healthy or enjoying. This will definitely give you the time to experience those kind of thoughts that will prevent those thoughts to turn into actions. Remember your own value and make time to do things you enjoy. Remind yourself of the things you value in your partner or loved ones. This is really helpful. And give it time. Give those jealous feelings some time. For example, while you might feel jealous as your best friend's wedding date approaches, on the day after the wedding, you might feel less jealous and more just happy for your friend. So give some time. Definitely, the intensity of the jealous thinking will definitely reduce. Finally, talk to a therapist or mental health professionals if you are having trouble coping with jealous thoughts or behaviors on your own. This can this can help, and therapist or mental health professionals can help with kindness and compassion, and they will tell you how to cope with the jealous feelings. They will unmask what are the underlying conditions that is triggering the jealous feelings. Dear friends, thank you for watching this video. I would love to connect with you. If you like this video, then share it with your loved ones. The mail ID of this channel is available in the description box. Feel free to give your feedback in the comment box, and you can also suggest any psychological content video you would like to watch. Take care of your body and mind, and remember that you are the leader of your life. Have a good day.